Okay, hello everybody today. We are on session number 7 of our series of coming out of quarantine and building your immune system and balancing stress. And today we've got Dr. Cheryl Duchess, who is a naturopathic doctor in the Tampa, Florida area. And if you don't know, a naturopathic doctor concentrates on looking at root causes of diseases, so why things went wrong to begin with. And she also has an online course where she teaches natural health and wellness. So she's been in the business for a long time and has a lot of stories to tell, and she's a marvelous speaker. So I'm really looking forward to hearing today what she's going to talk about with the supplementation program that she's liking to use. Go ahead, Dr. Cheryl.
Hi, Pamela. It's so nice to be with you today and everybody out there. And hope everybody's doing well. And you know, we've been going through a whole lot as this whole COVID-19 and the shelter in place. And my heart goes out to everybody that, you know, is going through illness or even the financial strain that this has put on everybody. You know, as a naturopathic doctor, I've been passionate about helping people, you know, really look at the root cause of disease like Pamela was talking about, and being able to understand your immune system. I think it's really important. Of course, we can't make claims that you know, that vitamins are going to cure or prevent. You know, I'm certainly not making any claims, but there are clinical studies with certain key supplements that we know that if you are lacking in certain nutrients, it can weaken your immune system. So I'm going to talk about a few of those and those that I use on a personal basis with, you know, the research that I've done. And you know, the one thing too that I always tell people when you're buying a vitamin is to look at the bioavailability, the absorption of it. And I was very fortunate 20 years ago to run across the isotonic line of supplements. I'm very, very convinced personally that that delivery system, which are powders, and when you mix them with water, they become the same osmolarity as your bodily fluids. And they're just fantastic. You know, they absorb in less than about 5 minutes, and they're going to drop down the small intestine. So when you are investing or looking at nutrition, obviously I want you to eat organic foods, lots of fruits and vegetables, a little lean protein. Try to get exercise in your life. No matter what, you need to get the exercise, because that is one of the biggest de-stressors. And I, you know, want to talk about some of the root cause of the immune system weakening, which could be a lot of stress in your life, okay? And right now, we know that we're all faced with stress because this is not normal. You know, we're not able to get together with family members or celebrations or have things to look forward to. So if you can get a regular eating routine of healthy food, and then also a regular exercise routine where you can blow off that stress, that's going to help with cortisol. One of the things I teach is, you may be familiar that we have, you know, really 2 glands that sit on top of your kidneys, okay, called your adrenal glands. And when we're under prolonged amounts of stress, those adrenal glands start to produce cortisol. And excess cortisol is a really bad thing when it comes to weakening the immune system and affecting people to have things like anxiety attacks or, you know, just, it just messes with you. You know, your B vitamins get lowered and so many things. So that's one of the things that I want to mention that I feel everybody needs to know about, is that there's a way to feed the adrenal glands and nourish them, not stimulate them. Like coffee and Red Bull and all that kind of stuff is the worst thing you could probably do when you're under prolonged amounts of stress, because now you're just weakening that gland even more. It's like tapping on a tired horse's butt and just making him keep going till he finally collapses. So one of the things that I love to use is B vitamins, okay? I love the isotonic B vitamins, B12, B6, folic acid, pantothenic acid. Those are really important with bolstering up your adrenal glands, okay? And we do a lot of things to destroy B vitamins. Sugar, coffee, you know, medications, which I know you talked about yesterday. Almost every over-the-counter medication wipes out your B vitamins. So I love the isotonic B vitamins. That's one of my favorite things to do for the nervous system. The other one is a formula called Bliss. And that's an ashwagandha. I think you had somebody else speak on that during your
Yeah.
lunch hour, but the Bliss formula, ashwagandha, bacopa, passion flower, these herbs will help to cause you to feel less anxious because they are nourishing and feeding the adrenal glands. And so that's just right up there. I think everybody needs to be aware, because this is starting to wear on people. Like, how much longer, is this going to go on?
Yeah.
And, we got to understand that that's causing an attack on a function in the body that's not supposed to be there. We need to try to, stress is only supposed to be for short periods of time, not long periods of time, right?
Right.
So
What about some of the general immune building herbs?
Yeah, the general immune things. Okay, first of all would be vitamin D. I always tell everybody, get your vitamin D checked, but pretty much across the board, most people are low in vitamin D. And most functional medicine doctors now are saying we want them to be around 70 to 100 nanograms, not even 50. 50 is pretty good. Man, that's pretty good. But really, if you want to really bolster the immune system, let's say you're working with cancer patients or whatnot, the functional medicine community are saying, let's get these vitamin Ds up. And so I love vitamin D with K2, the importance of having K2 in it, because that's like the traffic cop telling the calcium where to go. So you don't want to do your vitamin D without K2. That's very important to have that. And I love the isotonic vitamin D formulation. It's 5,000 IUs. 5,000 is a good starting point if you're low. If you're extremely low, I would even say, and maybe you're really wanting to bolster your immune system, I would say to do maybe 10,000 IUs a day of vitamin D. But that's one of the things. The vitamin D is an immune modulator, and the lack of vitamin D causes cytotoxic T cells to fail at fighting infection. Okay, so T cells need vitamin D to become active. So right there, that's a powerful, powerful reason why we would want to definitely incorporate vitamin D. So, it's important. The other one, of course, that you're familiar with is vitamin C. But before I go on, let me just read to you, vitamin D can be a contributing factor to many things, like suppressing your immune function, chronic pain, depression, anxiety, poor wound healing, low bone density, and hair loss and alopecia. All of those things could be contributing factors to not having good vitamin D levels. So that's why everyone should always go to your physician and request to have your vitamin D levels checked, right? Right. The other one, and again, I'm going to say it again, 70 to 100 nanograms is like the ideal, like really like getting them up there higher. Okay. And most people are not in the sun enough. They're just not. They're worried about, they're putting sunscreen on. We do get it from the sun, but it's hard to get them up without supplementing. And I think that the isotonic vitamin D, I've seen it compared to the prescriptions that other clinics are bringing in, and it'll raise those nanograms usually much quicker. Much quicker.
What about, I know a lot of people recognize vitamin C as one that's really good. What about the immune with the beta glucan? Can you explain how that works?
Yeah, that's one of my favorites is beta glucans. The way your immune system works with beta glucans, they come from either mushrooms or baker's yeast. And this Wellmune formula has been clinically studied quite extensively. They've done nine actual clinical trials of an ingredient called Wellmune, which is in the isotonic formula. And what this does is it increases the beta glucan's activity. So, it showed that the 20% average reduction in upper respiratory tract infections in a clinical trial. But how it works is we all have these white blood cells that are macrophage activity, okay? And what happens when you take a formula like the Wellmune, okay, is your white blood cells will eat that, all right? And then it starts to release what we call complements. And these complements, think of it like having a bloodhound and you put a scent of the rag in front of the bloodhound of the bad guy. And you say, all right, here's what he smells like. Now go get him. Okay. And that's what baker's yeast or mushroom formulas do that are called beta glucans. Okay. And they'll increase the ability for the white bloods to hunt out and find the bacteria and the virus. So that's why you'll see again with, you see clinics that work with cancer patients and stuff, and they'll work with these beta glucans to really help the white blood cells to be more active in their phagocytosis, which is attacking and engulfing and finding that virus or bacteria and getting rid of it and destroying it.
So it's actually kind of chewing it up.
Yeah. It's it's finding it, and then it's attacking it, and it's doing its job. But again, remember I said if you have low levels of vitamin D, you won't have these enough activity going on. So that vitamin D is really important. The well-immune, you see how they complement each other?
Yes. Is there any other complementary things to have the well-immune work well, or is the D the most important?
D and vitamin C, I think it's really important too. Yeah, vitamin C is one of those biggies. And in fact, in a study, ascorbic acid increased natural killer cell activity 200 to 400% after 8 to 24 hours. So having vitamin C, elevated in your system, we know that Linus Pauling has made that very clear to have enough vitamin C. And when you are working with, trying to loading dose, some people will do like 1,000 milligrams every couple of hours. But I would say, like, if you're sensing, something, your immune system being attacked, at least like 3,000 a day, separated out. And I do love the isotonic formula because it's non-irritating to the stomach, and these things are very, very safe. Yeah.
Right.
Yeah.
Right. Very good. Okay. Well, we're at 13 minutes already. You got final thoughts?
Okay. Well, I also would like to point out one of my favorite formulas is the pycnogenol or the OPC3. And that too has had some great research on immune building. It's a super antioxidant. It's a very strong antioxidant. And in clinical trials, you can go to pycnogenol.com and research it quite a bit. But it's been known to support healthy immune system, cholesterol, circulation, heart health, blood glucose, so many things. But you may not know that actually, and again, you can go to pycnogenol.com and pull up the research. I'm not making a claim about this product, okay, as far as how it's going to cure anything. I'm just saying the clinical studies are that it's been studied to be a very strong anti-inflammatory. It's been studied to help restore immune function and reduce the number of viruses in clinical studies. The other study of pycnogenol restores function to immune system, increases white blood cell numbers, and makes immune cells communicate more efficiently. So again, taking vitamin C and OPC3, they actually feed off of each other. They actually regenerate each other.
That's awesome.
Having multiple forms of antioxidants when you're trying to, really feed nourish your immune system. Yeah. So think of it like this: when we're taking supplements or when we're eating food, we're eating our broccoli, we're eating our oranges, we're doing good things, we're drinking our water. But this is like super powered, concentrated nutrients that feeds that at the cellular level. And that's what we're doing. If you're trying to grow a garden and you want the best fruit and vegetables to come out of it, wouldn't you dig up the soil and put fertilizer in it? And that's how I feel.
Exactly.
That's why we do these kind of things, and we invest in supplementation.
Right. Well, thank you. I really appreciate that you came on and shared all of that. Tomorrow we're going to be going a little bit more in depth with Jamie Morrow and the stress response, and she's going to be teaching over other few practical tips on that. And then the next day we're going to have somebody that does Zumba exercise over Zoom. So she's a personal trainer, so she'll be good. And then we're going to end up with a registered nurse, Ann Usted, that works in a functional medicine clinic, and what she's seeing of how quarantine, being in quarantine has actually helped some of our clients. So we've got still a few days left to go in this series. And if there's anything else you want to see or any subjects, I'm still deciding what I'm going to do from here, if I'm going to keep going or not with this kind of thing. So just give me your thoughts and let me know. And you guys all have a blessed day. Bye-bye.
Yeah, Pamela, hang one more thing. If you want to find me as far as the course goes, go to drcheryl.net, and I have a really wonderful naturopathic wellness course that's just my pride and joy. So, all
Yep,
right.
I put that link in there, and I'm going to link to
Absolutely.
some of these products down in the comments. So
Yeah,
great.
absolutely.
Thanks, Dr.
Bye.
Cheryl.
Bye-bye.
Yeah, bye-bye.
Bye-bye.